topic is management of Seymour fracture with nail bed repair in a 10-year-old child. Seymour fractures are juxtaepiphyseal fractures of distal phalanx of finger associated with nail bed injuries. These are rare open fractures which can lead to complications if not managed appropriately. This case report discusses the successful management of a Seymour fracture with a nail bed repair in a 10-year-old child. My case report. It's a 10-year-old girl child who presented to our ER with crushed fingertip after a door slammed on her hand. Physical examination revealed a mallet deformity of a ring finger. Nail plate was lying superficial to the eponychial fold. Radiograph says displaced distal phalanx physeal fracture with an overlying nail blade laceration. My surgical management was involved. Thorough irrigation and debridement was done. Nail bed was repaired with a 4-0 absorbable sutures. Fracture stabilization using a Kirschner wire across the distal interphalangeal joint. Nail augmentation was done by 3-0 ethylon, and prophylactic antibiotics were administered post-operatively. The post-operative period was uneventful. No signs of infection and complications were seen. Radiograph confirmed proper alignment and fracture healing. The K-wire was removed at 6 weeks. At 3 months, the patient demonstrated full range of motion and regaining normal nail growth. Seymour fractures are often mistaken for simple nail injuries and often physeal fractures that require surgical intervention. 2 important papers have been published in literature by Tarang S. Kharna and Sandeep Patwadan sir, as well as Mandar Akashi sir. Seymour fracture should be managed as an open fracture with early debridement, nail bed repair, and stabilization to ensure optimal outcomes. There is a high clinical suspicion that is warranted in pediatric nail bed injuries to avoid misdiagnosis and prevent long-term sequelae. That's all. Thank you.
What did you do or what is recommended generally for decompression of that hematoma?
Ma'am, just having one hematoma.
Subungual hematoma, how will you evacuate?
Ideally, it should be debrided or it should be removed with a needle, or the nail bed over the nail bed should be incised and the subungual hematoma has to be drained out. Prophylactically, antibiotic has to be administered before doing this procedure.
So it's not to be incised. What is recommended actually is multiple puncture holes in the nail bed. In your case, I noticed that the nail bed almost died. There was a lot of blackening in that superficial. So never repair it with tight sutures as well.
Yes.
Yeah. When you're doing a soft tissue stabilization with a KY, you could just leave it and
yes.
allow it to heal by secondary intention. That would have given you a much more perfused, much more aesthetic result.
Yeah. Yes, ma'am.
Next.
Next case, management of a lateral condyle non-union with tardy ulnar nerve palsy in a 10-year-old child. My case, a 10-year male child, alleged history of fall 4 years ago, was conservatively managed somewhere. He presented to us with a right cubitus valgus deformity with a tingling and numbness in little and ring finger. After doing X-ray was suggestive of malunited lateral condyle fracture, non-union. Normal carrying angle in a child is 10 to 14 degree. In a child presented with a left upper limb of 10 degree and right upper limb of 20 degree. So there was 2 problems. First, there was a deformity correction, and second, to tackle the tingling and numbness in the hand. So to deformity correction and to fix the non-union of the fracture, we first fix the non-union of the incarcerated union with a screw, and we do medial closing wedge osteotomy to correct the deformity. This was our immediate post-op X-ray. To tackle the tingling and numbness, anterior transposition of ulnar nerve was done intraoperatively. 6-month follow-up was done of this patient. After 10 months, the patient shows full recovery, and we are planning home for implant removal in the coming summers. Patient has complete range of motion in both sagittal and coronal plane. That's all. Thank you.